Students, today we are going to study estimation of serum albumin. So in this experiment, we require some requirements. The requirements are like the equipments and apparatus which is required are colorimeter, centrifuge, autopipette, and test tubes. Chemicals that we require as a albumin peat, still water, and sample we need is a huge unhemolytic serum or plasma, which is derived from heparin. Some general information about the test. Albumin is the major serum protein. So most of the protein present in the serum is a albumin. Albumin proteins keep fluid from leaking out of your blood vessels. So this is what one of the major function of the albumin, that it keeps uh, uh, fluid leaking from our blood vessels. It accounts for about 50 to 60%, 55 to 60% of total serum protein. So whatever the serum total proteins are there, like albumin, globulin, right? So out of all proteins which is within the serum, 55 to 60% is the albumin. The other function are like it maintain osmotic pressure, transport long chain fatty acid, bile salts, bilirubin, hematin, calcium, and magnesium. So these albumin proteins are helpful in the transport of many substances in the blood. These substances are usually not soluble in water, so they require a carrier protein. So albumin here acts as a carrier protein here. Let's know about some clinical significance of albumin. This albumin test is clinically significant. Elevated serum albumin level are usually the result of dehydration. So this is the common condition where the high level of albumin may occur in the serum because of the dehydration. Let's say the patient has not taken water through entire day, and the level of albumin may become higher side. So this is the reason is the dehydration. Decreased albumin levels are found in a wide variety of conditions, which may be related to the physiological or pathological condition. So decreased levels are like kidney disease, liver disease, malabsorption, malnutrition, severe burns, infection, cancer. So these are the conditions where you can see that the albumin levels may be low than what we found in the normal range. Bromocresol green method. This is the one of the method which we use for doing albumin test in patient sample. What is the principle of the test? The BCG, what we call bromocresol green, is based on binding of bromocresol green specifically with albumin to produce a color complex. The reaction we can write here as albumin and bromocresol green react with each other and produces a color complex. The absorbance is directly proportional to the albumin concentration in the sample. So when we measure the absorbance at 580 to 630 nanometer, so at that time the absorbance of the mixer is directly proportional to the concentration of albumin in the given sample. These are the procedure. We'll take 3 test tube. It should be cleaned and properly dried. We should label T as B, T for test, S for standard, B for blank. Now pipette the respective ingredients in this respective test tubes. So these are the ingredients like serum, protein standard, and distilled water, and BCG reagents. So these are the ingredients. So we need to pipette, means we need to measure the volume in that, and we have to pour in the respective test tubes. So what is the instruction to measure? Like BCG reagent, we have to take 1 ml in test, 1 ml in standard, 1 ml in blank. Serum sample we need to take 0.01 ml, that is 10 microliter in test. Protein is standard, the concentration is 6 gram per dl. We should take in standard tube, same volume 0.01 ml, and distilled water we can take 0.01 ml in blank tube. After that, we need to mix properly and incubate at 37 degrees Celsius for at least 1 minute. So at this time and the temperature, there is a proper mixing takes place, proper reactions takes place, and there will be color development. We need to measure the absorbance at 550 nanometer, and we need to do calculation. Serum albumin in gram per dl is equal to OD of test divided by OD of standard multiplied by the standard condition is 3.6 gram per dl. So this is what the results you can write in albumin equal to whatever the value we will get from the calculation, we'll write the results in a gram per dl. Normal range for albumin is 3.2 to 5 gram per dl. So this is the normal range. If the value is less than 3.2, then there will be less albumin in the sample. If the value is more than 5, we consider the elevated level of albumin. Usually we see in dehydration condition, but the less level of albumin is somehow clinically significant. This albumin protein is usually synthesized in the liver, right? So liver is responsible for making abundant amount of protein, albumin protein, and it comes in the blood. It helps in the transport of many substances. It maintains the osmotic pressure. It maintains uh, uh, normal like it maintains the blood vessels. Prevents leaking of the blood vessels. Okay, so this is what the calculation result, normal range, clinical significance we have studied. There may be some technical errors because of that. Uh, there may be the wrong results, wrong calculations, okay, and wrong reporting. So, what are the errors? Like ecteric and lipemic sera may interfere with the test. What is ecteric? Ecteric means the patient has the high bilirubin in the blood. So because of that, the jaundice patient have a high bilirubin in the blood. So more bilirubin in the blood is called as a ecteric sample. What is lipemic sera? Lipemic sera means there is a high level of lipid in the serum. So ecteric and lipemic both interfere with the test. Ensure complete clot formation has taken place prior to centrifugation. For blood sample, what sample we need to take is the serum. Let's say you are taking serum. So ensure that there is a proper clot formation. Then after that, we can do the centrifugation process and we can set serum. Right? So clot formation process should be sufficient time should be given. So now, any question for this? Is there any question? We have learned how to perform albumin test in the serum. So any question, please ask.